As primary healthcare practitioners, chiropractors have an ethical and moral duty to be advocates for public health. Events of the past 12 months have shone a light on public health like never before, emphasizing the need for all health professionals to engage in matters that directly impact on the communities, societies, and cultures in which we live. Public health has been defined as the science and art of preventing illness, prolonging life, and improving quality of life. We all have a role in promoting public health. As chiropractors, we have a unique opportunity to advance public health, both with our patients and beyond the doors of our offices and clinics. This short presentation will set out the role of chiropractors in public health from a global perspective and how the World Federation of Chiropractic is working to stress the importance of public health and contribute to efforts to improve human health on the planet. The vision of the WFC is a world where everyone has access to chiropractic so that populations may thrive and reach their full potential. This vision reflects our role in public health. As a profession, we work to optimize the health of populations. We believe in universal health coverage and that every individual has a right to the highest attainable standard of health. Access to the services of chiropractors is part of achieving healthy populations and communities. Our mission is about wanting more people to know about chiropractic, more people to use chiropractic, and for chiropractic to be part of people's healthcare teams. Now, being part of a healthcare team means advocating for globally accepted public health interventions and promoting measures that will keep society well and safe from communicable and non-communicable diseases. In 2017, the WFC launched its Be EPIC campaign. EPIC stands for evidence-based, people-centered, interprofessional, and collaborative. We believe that every chiropractor throughout the world can be EPIC. The campaign has been hugely popular and has been supported by chiropractic organizations, chiropractic educational institutions, and individual chiropractors in each of the world's 7 regions. The P of EPIC is purposefully people-centered, not patient-centered. Now, when we were putting our EPIC campaign together, we consulted a number of organizations, including the World Health Organization. And they said to us, if we're a primary healthcare profession, why do we just want to talk about patient-centeredness when our role as advocates for health extends beyond patients? They advise us to consider people-centeredness, which better reflects modern healthcare's role in the community and better emphasize our potential to play a role in public health. The World Health Organization is an executive agency of the United Nations. It was established in 1948 and is considered the global authority on public health and on public health policy. The WFC has been a non-state actor in official relations with the WHO since 1997. And each year in May, the WFC sends a delegation to the World Health Assembly in Geneva, where we meet with WHO representatives from a range of departments. In 2005, the WHO published guidelines on basic training and safety in chiropractic, and the WFC has provided input into a range of other official WHO documents since this time. Currently, WFC is working with the departments of non-communicable diseases, integrated people-centered health services, classifications, traditional complementary and integrated health, and global health workforce. Now, the WFC is also a full member of the NCD Alliance, the Non-Communicable Disease Alliance. or NCDA. Now, traditionally, non-communicable diseases have overlooked musculoskeletal conditions in general, and spinal disorders in particular. And the objective of the World Federation of Chiropractic at the NCDA is to advocate for and highlight the global burden of disease and disability related to spinal disorders. With an estimated 540 million people in the world suffering from spinal disorders at any one time, we argue that spinal pain and disability impacts hugely on public health and has significant and established connections to comorbidities, such as reduced physical activity and adverse mental health. Now, as primary healthcare professionals, chiropractors have a duty to promote public health as part of their work. Now, the WFC's commitment to public health is underscored by the fact that we have a dedicated public health committee. Chaired by Dr. Claire Johnson, the WFC PHC has membership representing the WFC's 7 world regions. The WFC's Public Health Committee's role is to identify public health priorities within the profession, implement health promotion activities, coordinate public health campaigns, and support and encourage alignment with WHO activities and programs of work. Now, in 2018, the WFC Public Health Committee published a white paper describing its agenda. It was the product of discussions within the committee looking at key areas of public health importance. The WFC Public Health Committee was particularly mindful of the third of the WHO's Sustainable Development Goals, or SDGs. Now, SDG 3 deals specifically with health and articulates the goal of ensuring healthy lives and promoting well-being for all at all ages. So with this in mind, the 3 principal areas of work of the Public Health Committee are in the following areas: women, children's and adolescents' health, healthy aging, and chiropractic's role in the opioid crisis. However, the COVID-19 pandemic of 2020, 2021, and possibly beyond has focused the world's attention on matters of public health. Promotion of measures to reduce transmission have been the responsibility of global public health bodies, but health professionals in all disciplines have had to pivot to ensure that they were reinforcing the messages in act as well as in word. Not only have chiropractors engaged in preventative measures within their clinics and offices, they've also been advised to engage in the promotion of the global vaccination effort. And some chiropractors have even been trained to participate actively in the vaccination administration program itself. The WFC Public Health Committee has been active in providing advice notes during this time and disseminating information and recommendations from the World Health Organization. Now, away from the coronavirus pandemic, the WFC owns and coordinates arguably the biggest single spinal public health campaign in the world. World Spine Day takes place on October the 16th each year. It's a day which highlights the global burden of spinal pain and disability and encourages governments and populations to raise awareness and engage the public in activities to take action. Each year, we select a theme that has a global appeal. It's easily translated and it can generate ideas for participation that are evidence-based and consistent with international guidelines for the management of spinal disorders. Our last 3 themes have been Love Your Spine, Get Spine Active, and Back on Track. World Spine Day is not just directed at chiropractors. All professions that are involved in providing spine care are invited to participate. And as a consequence, we've seen neurosurgeons in India, physiotherapists in Ghana, rehab specialists in Australia, and of course, our global community of chiropractors all taking part and promoting public health in the form of advancing effective spine care. This event generates worldwide media attention and social media posts from politicians and government figures. We encourage all chiropractors to get involved and Each year, the WFC runs its own World Spine Day competition for our National Association members, for chiropractic education institutions and private clinics and individuals. So, in summary, the chiropractic profession is excellently placed to promote, advance, embrace, and engage in matters of public health within their communities and in societies around the world. Public health provides chiropractors the opportunity to demonstrate their evidence-based, people-centered, interprofessional, and collaborative credentials. Now is the time for chiropractors to look beyond their role as clinic-based healthcare providers and meet society's expectations of modern primary care experts, where public health plays a pivotal role in creating happier, healthier, and more active populations. Thank you.